Happy New Year. Now for some, setting New Year's resolutions brings them a sense of fulfillment and achievement. For others, however, it can feel like a lot of pressure and it can bring on anxiety. Now, if you're one of those latter people, why not think about setting yourself an intention rather than a resolution? So for example, if your resolution would ordinarily have been to cut out sugar, why don't you set yourself an intention to try and listen to your body more and allow it to tell you what it needs to nourish it? Or if your resolution would have been to run a half marathon, why not set yourself the intention to listen to the kind of movement your body needs and what makes it feel good? Either way, whether you're setting yourself a resolution or an intention, if the new year and the prospects of January is bringing you down, here are some tips to try and help get rid of those January blues. Mindfulness. Now, the practice of mindfulness can help with maintaining your focus on the present moment rather than worrying about future anxieties. It often combines the practice of taking slow, deep, deliberate breaths with observing the anxiety, just not feeding it, instead just letting it go. Now, it can be really difficult to practice mindfulness or meditation when it's not something you've done before, but there are a number of apps, audiobooks, websites, guidebooks, all out there helping guide you through your mindfulness and meditation. Socialise. Now, it can be so tempting just to become a bit of a hermit in January after having had such an intense social calendar in December, but we do know that seeing other people and socializing does help us keep a positive outlook on life and helps with those feelings of loneliness. So do set aside time for a coffee with friends, make the effort to go into the office if you're feeling lonely, or have family over for a movie night. Prioritize sleep. It's really common for our sleep hygiene to fall to the wayside during the festive period. So let's use January to just get our sleep patterns back on track. Evidence support the need for 7 to 8 hours of sleep each night, and those that regularly sleep less than this are at increased risk of serious health problems, as well as the emotional impact that low amounts of sleep can have. Keep exercising. During the festive period, it can be very difficult to keep your exercise routines going. So let's make that effort to bring movement back into your January. We know that exercise can help manage stress through endorphin release, and it has been cited that regular exercise can reduce the risk of depression by up to 30%. Eat some good mood food. Whilst there's no specific formula for food that equals good mental health, and it's a rarely a one-size-fits-all type of thing, there are certain specific nutrients that have been associated with improved mental health, and they include omega-3, selenium, tryptophan, zinc, folic acid, fibre, and probiotics. Now, if you are eating a well-balanced, healthy diet, the likelihood is that you're already taking in all of these nutrients anyway. But let's make that extra effort this January to try and eat the rainbow, eat diversely, cook from scratch where possible, and enjoy your food. Vitamin D supplements. Now, this vitamin is mainly made through a reaction from the sun on our skin, but during the months of October to March in the UK, we're often not able to make enough vitamin D. So it's suggested that during these months in the UK, adults take a 10 microgram supplement of vitamin D. You can get some vitamin D in small quantities in certain foods like egg yolks, oily fish, liver, and red meat. It's mainly needed for maintaining healthy bones, teeth, and muscles, but more recently, it's been linked to other systems, so optimizing our immune system, reducing inflammation, and even in mood regulation.